Hello, lovely viewers. Welcome back again to another health episode with Asasika. In today's video, I'll be discussing about kidney failure, which has been ranked the 8th cause of death across the globe. So there's lots to study. We are going to know the functions of our kidney today. We are also going to know how kidney failure occurs, what are certain health complications that can lead to kidney failure. If you've already been diagnosed of having a kidney failure, don't worry, we are going to discuss about the treatment options for you. I'm going to also discuss about some healthy lifestyle tips that can be helpful for people living with kidney failure. Don't go anywhere, this is still time with Asasika, your health, your priority. Kindly share, subscribe, and don't forget to click on the notification button to get notified whenever a new video is being uploaded. Stay tuned. Before we delve into kidney failure, what at all is kidney failure and everything, let's first look at the location of our kidneys. Where can we find our kidneys in our body? So we have two kidneys as humans, and they can be found at the back of either side of our spine. We have one spine, and on each side we can find one kidney. So there are two kidneys. Now, the function of kidneys. Kidneys clean waste products from the body, from the blood, by making urine, and they also balance certain amounts of levels of certain substance and elements like sodium, potassium, and calcium. So they make sure that these elements are on the same level. One is not higher than the other. So they maintain the levels of these elements in our body. They also make hormones that regulate our blood pressure and the red blood cell formation. Here, when your kidneys are not able to filter these waste products from your body, they accumulate. They build up in the kidneys and they lead to kidney failure. There are certain health complications also that can lead to kidney failure that I'll be discussing further in our video. So, kidney failure is when your kidneys are no longer able to work well enough to keep you alive. So here we are talking about a percentage of 85 to 90, meaning your kidney function is gone. So you have to seek for treatment options. How kidney failure occurs. As I've been saying in the video, when your kidneys are not able to work properly as they should, the waste product gets built up in your kidneys. Now, there are only two options. Either you get a replacement or you be on a temporary treatment, which is the dialysis. So here, there are certain health complications that can lead to kidney failure. 1. Hyperglycemia, high blood glucose level. If you're a diabetic patient and then you've been diabetic for a longer time, kidney failure can be one of the secondary comorbidities that you can have as a diabetic patient. So if your glucose level is high, please start taking care of yourself. Start getting on some healthy lifestyle habits that can help you manage your kidney function. The second health complication is hypertension, high blood pressure. When your BP is high, you are likely to have a kidney disease. So as I said earlier, if you would recall, I said that the kidneys also produce some hormones that regulate our blood pressure. So if your kidneys are not working properly to produce that particular hormone, meaning your blood pressure would always remain high. So high blood pressure patients also have a risk of having a kidney failure. And when there is a damage to your kidney tiny filters, so I said the kidney's function is to clean all the waste products. So how do they do that? They filter the waste products. They take in the good ones, they retain the good substances in the body, and they excrete the other ones. So the tiny filters, the filters in the kidneys, when they get damaged, also you are at a risk of getting a kidney failure. So if there are no filters, that means all the waste products, the good products and also the waste product will be coming out of your system. Those good ones are supposed to be retained, but in the case where the filters are being damaged, both the good substances that are needed will be out and the waste product would also be out. Yes. The next Health complication is polycystic kidney disease. So polycystic kidney disease is when there are air sacs, like a sac, a bag of a bag that is being is being grown on your kidneys. So these bags, they are small tiny bags that grow on the kidneys. They call it a cyst, and non-cancerous sacs that are filled with fluid. They grow on your kidney. As time goes on, these sacs, they are not cancerous but non-cancerous. So when these sacs grow on your kidneys, it gets to a time where they form a cluster. A cluster means they form a group. So this can also affect your kidney function. It disrupts the structure of your kidney and can lead to kidney failure. Here are the various treatment options for people with kidney failure. 85 to 90% of your kidney function has been lost. Your doctor will suggest any of these two treatment options. The first one is dialysis. That is a temporary treatment. So here with the dialysis, what it does is that it removes the salt, the acid, the potassium, the waste products from your blood. So this is the function of the kidney. So since your kidneys are not able to do that, the dialysis will do that for you. So it's a machine where you go to the hospital and then you'll be seated, and then a tube will be stuck in various parts of your body. So there are two types of dialysis. We have hemodialysis and peritoneal dialysis. So the hemodialysis is when the tube would be placed in your vein at your neck or your leg. So any one of the location will be chosen, and this dialysis takes 3 to 4 hours, 3 times in a week. Now the peritoneal dialysis, which is a permanently placed tube in your stomach where the fluid will be running into the abdomen. So here the same function as taking in all the products and then all the excess elements from your body. So unlike the hemodialysis, some doctors prefer to put patient on the peritoneal dialysis. That would depend on the doctor's opinion and suggestion based on certain assumptions. So the second treatment option is kidney transplant. So this treatment option would be suggested by a doctor when your kidneys are still deteriorating. Even after being put on dialysis, your kidneys are still not catching up. So here your doctors, based on your lab reports and certain factors and parameters, your doctor will suggest a kidney transplant. So I wouldn't be explaining much about kidney transplants. Here are the 7 golden rules for kidney disease prevention. As they say, prevention is better than cure. So why don't you prevent yourself from getting a kidney disease? The first one is getting a regular checkup. In a year, 2 times general checkup wouldn't be bad. You go to the hospital, you get some labs done, you check up your kidneys function and see if all the enzymes are on a normal range and your kidneys are functioning better. The second one is controlling your blood pressure. In my previous videos, I've talked about hypertension, ways you can control your blood pressure. If you haven't watched that, kindly go through the videos and check them out. The third one is manage your blood sugar level. Yes, blood sugar level also is very important. Please take care of your sugar levels. That also you can find a video on my page. Yes, on Time with Asasika. I've explained a lot about blood sugar, how you can manage your blood sugar level. Eating a healthy diet. Food is important. Please take care of what you take in. Your food should be your medicine, okay? So eat a lot of veggies, fruits. Get a balanced diet every day whenever you're having a meal. Exercising is also one of the rules. Quit smoking. Smoking isn't good for the body. Your lungs, it wouldn't help your lungs. Please do not overuse pain meds. If you're having any pain, whether headache, whether it's a stomach ache, see a pharmacist. Don't be prescribing yourself medications, or go to the doctor if you're having any doubt, okay? Because certain pain meds also have some complications on our kidneys. So please make sure that you avoid the use of too much pain meds. Lastly, let's look at some tips that can be helpful for people living with kidney disease. The first one is keep your salt intake to a minimum. Okay, try to eat a little amount of salt. It will help your blood pressure, and at the same time it will help your kidney function. 2, avoid high protein diet. Okay, avoid high protein diet. Too much of meat, avoid them. 3, choose foods with low fats. Okay, choose food with low fat. If your cholesterol are high, it wouldn't help you as a kidney patient. So take in less foods that contain fats, okay, with a lot of cholesterol. And then the next one is stop smoking, as I said, and get fit. Stay healthy and strong, and you're gonna be fine. If you've been able to watch this video to the end, kindly send me your name and where you're watching me from in the comment section, and in my next video I'll give a big shout out to you. Like, subscribe and share, and don't forget to click on the notification button to get notified whenever a new video is being uploaded. This is Still Time with Asasika, your health, your priority. Bye bye.